The topic is, if you're injured, the first 72 hours is really everything. Today I have with me my friend Cory Belnap. He has created a space called Ortho Injury Now with a co-owner, and they are doing some incredible things. It's essentially an urgent care for any kind of injury or pain.
There's a lot of guesswork in those first 72 hours. Am I hurt enough to go see someone? How quick can we get you healing? And I think that's the biggest part for a patient. I think if you get expedited care and you have an answer as to what's truly going on, that forms and frames basically the network of like where you need to go.
The door you choose could lead you down a really wrong path. And with tears in her eyes, she said, I can see why people get addicted to pain medication. Welcome to the Healthcare Revolution podcast. I'm so excited to have our guest today, which I'll introduce soon. But I really want to preface our podcast today. The topic is, if you're injured, the first 72 hours is really everything. That's what we're talking about in this podcast, because ultimately we need to solve injuries fast. People stay in pain for way too long, and we need to expedite that healing process. And there's things that we've done in our society that slow that down, and there's things that we have done to speed it up. And we want to give you the best resources to solve your pain and injury problems in the most efficient way. So really excited to dive into this. A few things to think about. If you're injured, like I said, the first 72 hours are everything. And most people get this wrong. Most people go to the wrong route first. They wait, they guess, they go to the wrong place. And we don't really know what should have been done. And we really want to get to those answers quickly. So today I have with me my friend Cory Belnap, which I only met just a month ago.
Seriously.
Roughly.
Yeah.
And he's such an amazing person, such an amazing healthcare provider. He has created a space called Ortho Injury Now with a co-owner, and they are doing some incredible things. It's essentially an urgent care for any kind of injury or pain. So you have anything, you think it's a fracture, you think it's an ankle sprain, it's a walk-in clinic that you can go. He has 3 of them here in Utah that you can just drop in and they'll see you right then. And what I love about what he's doing is he literally expedites care in such a fast manner. He is messaging our office and other offices, and they're getting in sometimes same day or next day. And he is speeding this process up. He's doing incredible things. He's going to change healthcare in Utah forever, him and his team. So, Cory, welcome to the podcast.
Thanks for having me.
How was that introduction for you?
It was great. I guess. It was great. It was great. And a pleasure to be here.
Yeah, so excited to have you. Tell us what got you into this. Like, you got done with school, and what drove you to start this practice?
Yes, it was actually my first job out of school. I worked in hand surgery, and I was working actually out in the state of Illinois with a big group, and they were a fantastic group. I can only claim like all my roots were definitely built there, and they had a clinic like what we have, and it was fantastic. And the person who basically started it or ran it and started it, he just became a huge mentor to me. And I just saw how patients could be expedited in terms of their injury, their chronic pain and whatnot. And because I had roots back here in Utah, I'm from Utah, and I had worked with my partner before, Dr. Dunn, we decided at some point after about 4 or 5 years of talking about it that we're like, hey, we're going to bring it to Utah.
We're done talking about it. Let's make it happen.
Make it happen. Exactly.
I love it.
Yeah.
And if anyone that's started a business, you know how it is getting it off the ground. And I will say, I owned a painting company, painted houses. Healthcare business and
different
painting business, completely different things. We have consumers, which in painting is, it's the client, right?
Yeah, absolutely.
In healthcare, we have the patient, but who's the actual payer?
Yeah.
Most of the time, it's an insurance with different rules.
100%.
So things get really complex in the medical system, and there's a lot more to navigate than a small painting company. So
many things.
But let's dive into our topic. Like, why is the first 72 hours of an injury so important to get treatment?
Yeah, I mean, I think there's a lot of things that you could go down the road of. I think the biggest thing is there's a lot of guesswork in those first 72 hours. Am I hurt enough to go see someone? That's part of it. I think the other part is like, how quick can we get you healing? And I think that's the biggest part for a patient. I think if you get expedited care and you have an answer as to what's truly going on, that forms and frames basically the network of like where you need to go. And whether that's with, non-operative, whether it's through physical therapy, whether it's through our clinic, whether it's through other clinics that are like ours, or whether it's through a surgeon or somewhere else, I think that part of things makes a difference in terms of how you get healing and how you get back to things that you like to do.
Yeah, talk to us about the anatomy. Like as far as, say I just sprained my ankle.
Yeah.
What happens with the inflammation? What happens with your body? And, you and I have seen cases where people go to urgent care and they put them in a boot for 6 weeks.
Yeah.
Like that we've learned is not the best quality of care.
Right.
And you're literally slowing things down drastically. But tell us about the swelling and why it's so important to get some of these things moving or get them to the right spot at the right time.
Yeah, obviously what we know now is very different than we knew 40, 50, 60 years ago, whatever that is that we've been kind of holding on to. When you have any kind of tissue injury, there's certain things that you want to do to protect that injury to make sure they're not worse, that you're not making it worse or that you get more injured. But then there's the aspect where you say, hey, some of this inflammatory response, it's a good thing to have that. It's your body's way to heal.
I'm so glad you said that. That's really important because people
Right?
think that swelling is a bad thing.
I think the misconception in general is swelling is a byproduct of the inflammatory process, right? That's nerdy. That's whatever. When we think of inflammation and swelling, they're the same. The reality of it is inflammation is part of the process. And so we want that to happen. But the byproduct of that is swelling, which can create some problems with that.
And
so
it's essentially uncontrolled swelling.
Exactly.
We want to facilitate that, right?
100%.
Because the reason why it swells, as we know, is the body's trying to protect it.
100%.
So it throws swelling in there so you can't move it.
Correct.
Right? Because it wants to stabilize it.
What's great about our body is it has protective mechanisms, right? And that's the cool part about our bodies is there's so many physiologic mechanisms that help us in that process. And we want those things to work to be able to get better, to heal, to get back to life, whatever that is. But if we're hindering those things, that becomes a problem.
Yeah.
And if we're trying to do things too early, it can create other problems that maybe adds to the injury.
Yeah.
So.
Imagine for a second, like you have we'll just go back to the ankle sprain.
Yeah.
It's swollen.
Big one.
You're like, just walk it off.
Yeah.
Right?
Yeah.
There's that.
Yep.
But then there's the opposite side is like throw it in a boot for 6 weeks.
Right.
Right? Both can be very damaging.
100%.
Because you start walking on it too soon, you're just promoting it to get more swollen, more irritated. You're not protecting it. Yep. But then if you overly protect it, then you're getting to super stiff ankle. It's not getting blood flow to it. Then you got 12 weeks of rehab to get it better. Like you don't have to go either path. There is a middle ground.
There's a nice middle ground
that really benefits so much and can get it better drastically faster.
Absolutely. Yeah, I think that from our standpoint, what we see, and we see a ton of ankle sprains obviously in our office, in all of our offices, and just in orthopedics or sports medicine clinics and PT clinics, we see these all the time. And the reality of it is there is that protection time where you want to make sure that you're doing the right thing, but also getting moving. And that's probably the more, if we talk about more recent, advances in medicine, we know that needs to happen. We know that we want blood flow to the tissues. We know that we want to work on getting some of that extra swelling out so that they can ultimately heal.
Yeah.
So.
And I love what you're talking about. Like we're trying to get that extra swelling out because we want to essentially facilitate the healing process.
Yeah.
The body stays stuck unless you tell it what to do, right?
Yeah. There was a time where you sat and just kicked it up and did nothing. And now it's some of that is good, but you also want to do the right things to move it. Protect that injury, but also protect it the right way.
Yeah, we
not forever.
We kind of joked earlier that the old term RICE, which is rest, ice, compression, elevation, is outdated. And we did a podcast on kind of the newer models, which is police and peace and peace and love. And we kind of joke that it just confuses people.
It does.
Right?
I think so.
I really love the police because it gets the majority of it in there. The peace and love is just like really lengthy and people forget. I even forget. I don't even know if I could quote them all. But essentially, police is protect, optimally load, and then you have your ice compression elevation.
Yeah. And
ice is kind of dicey because it's like you ice for too long and it vasoconstricts, doesn't allow blood flow. And we realize if you ice for too long, it actually inhibits the healing cycle, right?
Right.
So over icing is too much, but in general, I love the police. What's your kind of thoughts on that?
I do too, and in fact, we probably before the podcast today we talked about that. I kind of got introduced to that word myself. With that being said, I think from a patient perspective or from just an injured person perspective, the biggest thing is if you keep it simple, that's the easiest part of things, right? And I think that's why Rice was so good from a verbiage standpoint. But now we know that, hey, I think the biggest thing is optimally load. I like that because I think that ultimately there is some loading that you can do to make sure that blood flow is coming to the tissue itself, depending upon the injury. I mean, if it's a broken bone, that might be a different story, right?
Yeah, we want to stabilize that.
Yeah. And if we talk about finger injuries and finger sprains and we talk about ankle sprains and all the different things that we see, some of these things can move right away and some of these things really need a little bit more protection.
Yeah, for sure. But yeah, these are all things that are really important for people to understand, right? Because the goal is to get them out of pain faster, the most efficient way. Right? Yep. And there's ways to slow down the healing cycle and there's ways to speed it up.
Right.
And we're working on efficiency, not fast, right?
I totally agree.
Because sometimes slow is fast, right?
Agreed. I mean, I think if you're doing things just trying to get back and you see this in the clinics, you see this, it's like, hey, I've got this thing next week and I've got to do this thing to get back to this. Sometimes maybe that's possible, maybe it's not. But if we're doing things as a long-term treatment option, yeah, it might take just a little bit longer. But if we work on it from the very beginning, ultimately we're going to get there quicker.
Yeah, I had this girl. I'll never forget this story. This was my claim to fame.
Okay.
You ready for this?
I'm ready.
I had this gal that was running a half marathon, just a cute little petite girl.
Okay.
And she was training extremely well, did things perfect, and I wasn't treating her at that point. I was treating her friend. And about a week before the race, she came in and she could not walk on her hip. And she didn't know what she did. It was just killing her. And she's like, I just can't even put weight on it. And I gave her 3 or 4 things to work on. I said, just be patient. I tested some things. Everything was clear. There was no fractures there. There was no soft tissue injuries. I just kind of diagnosed this. You pushed it a little too hard, irritated some tissue. You're going to be able to walk on it a few days, and you'll be able to run the race. That was what I had told her, and I said, just stay optimistic. Yeah. Let's see how the next few days are. Let's take, back off your runs. Yeah. So you can hardly walk right now. Let's focus on walking. Let's focus on non-weight bearing exercise. Get blood flow to the tissue. She freaking ran that race a week later, and she met her PR. She got her new record, and she was so happy.
I love those stories.
But it was like one of those things. She's like, she would have had to quit the race. She trained for 6 months, right? But our job is to help them identify, is this an injury or is this tweak that's going to go away in a couple days?
Right.
Or is this a fracture, right?
Yeah, absolutely. I mean, I think when you talk about overuse injuries, sometimes those are the hardest ones that you deal with because you're like, well, there wasn't like a specific instance where this happened. But then it's really more... Again, from a provider perspective, it's more of a let's talk about the history of this and let's hear it out loud to like what's going on. And I think in our world where we sit, it's like you can try to make sure there's always something that's happening, and sometimes it's just like, hey, let's give this a little bit of a chill out, and then we have a PR.
Absolutely,
which is great for her.
Let's dive into the common mistake that people make, and that is just waiting. Let's just wait. Give us some stories of what you've seen in the clinic of just people waiting, thinking injuries will go away. Because we're talking about the 72-hour rule, right? Like, let's get in. Yeah. Let's get working on this, right? But what happens when people wait too long?
I think the concern, it depends on the injury. So I had a patient in my office literally on Monday afternoon and, jammed a finger. We've all done it. Playing basketball, playing football, jam a finger. And unfortunately for this, I guess it was on Friday that this happened to this individual. And unfortunately, there was swelling, there was whatever. She didn't dislocate. So she's like, hey, this just jammed my finger. That person had waited 3.5 weeks to come into the office to get an x-ray. And that was where the problem came. Unfortunately, this individual had a bad fracture that was displaced. And you can tack it up to pain, you can tack it up to swelling, you can tack it up to a jammed finger, but ultimately came in, got the x-ray. This was a surgical deal. And the hard part about that is, as you know, tissues are already starting to heal. And so in that scenario, just the x-ray alone initially early on would have made a huge difference for this person. This is going to be a very different outcome 3.5 weeks later than it was early on. Not to mention just the fact that she dealt with this for 3 weeks.
Yeah,
right?
It's miserable. Yeah.
And just kind of said, hey, no big deal. But then when you got the x-ray back, you're like, gosh, this really could have been a better outcome long-term early on in those first 72 hours.
Yeah, and who knows what that looks like, 6 months from now. But the misery, the rehab that you have to do on that. I mean, just think 3 weeks. It takes roughly, 6 weeks for a bone to heal. You're already halfway there.
Oh, yeah.
The body's
there was already
down.
healing.
Like you could see on x-ray that the body is laying down tissue to repair it in the state that it currently is.
Correct.
So with you and yours, like it was dislocated.
Yep.
It's healing in a dislocated way. What do you have to do? You probably got to re-break that.
You got to re-break it, you got to open it up, and unfortunately it just becomes a less functional finger for this individual. And unfortunately, there's not much you can do. I mean, you can do stuff to get it a little bit better, but...
Which finger was it?
Small finger.
Oh, pinky finger.
It's
That's
our grip.
It's
our grip.
Yeah,
it's our grip, and people don't realize that.
It's a big deal.
You want that. You want all your fingers. Let's be honest.
I don't know if you know this, but I cut off the tip of my finger.
See?
If I ever show you, you got to do the swing. I mean, if you can't see that on camera, I'm sorry.
This is
my middle finger, the one I use the least.
Yeah.
I wink when I say the least.
That's right. That's right.
It's the same size as my other two fingers, so I can do the swing with it.
Yep.
That's my party trick.
That's it.
But I can attest to you don't want to lose fingers.
Right.
It's a big deal.
And it's a painful recovery, if nothing else. I mean, that's a big part of it. But
I have broken 34 bones, Cory, and I will tell you, I have never experienced more pain in my life than this middle finger.
As it was healing.
Yeah. I mean, I had to get the top amputated.
Yep.
But it was the most painful thing I've ever experienced in my entire life.
Super sensitive.
Yeah, there's so many nerve endings, as you know, in the fingertips. But I will say, if you're gonna have an injury, make sure I'm saying don't do it with the hands. The hands are miserable. Yeah, but do it to the middle finger. Exactly. That's the least functional one.
That's right. That's right.
But yes, so let's, tell me about like the other injuries that you see that are we don't want to wait on. We talked about hands. Like, what are other injuries that you see commonly that people just wait too long? And I'll share a few too here.
Yeah.
But what are your thoughts there?
I mean, I think finger ones are a big one. I think wrist injuries are another big one. If you fall on an outstretched hand, we call it a foosh. But if you fall and land and you're still painful the next day or the day after, it really should get an x-ray. It really should, because there's a couple bones in the wrist that ultimately, if they don't get treated well or diagnosed well early on, and they can go misdiagnosed even getting an x-ray. And I think that's where some of the challenges come. But with that being said, if you get to those early, they become a much better outcome. I think ankle injuries, I mean, as much as we want to tack everything up to an ankle sprain, it's not always an ankle sprain. And I think that's the hard part. There's so many rules that you can go by or things that you have to remember, acronyms. But the reality of it is, if you get injured and the next day or two is still painful, it's time to at least think about that.
Yeah. And keep in mind, people, we're talking about an x-ray.
Yeah.
You get some good information. You had a trauma. Get an x-ray. It's like, what, $30?
Yeah.
Something like that.
Depending on where you're going.
Depending on insurance.
30 to 70 is probably an x-ray.
But the most simple exam that you can do to get some good information. And sometimes the image is not giving you a clear picture, and you need to
Sure.
do a repeat based on swelling. I mean, I used to have this general rule. I broke so many bones. I'm like, I'm going to go in 3 days.
Yep.
Because
That's your rule.
the swelling goes down, and this was before I was medical. I would
Okay.
I would always wait 3 days, and it was crazy because sometimes I broke both my arms, and I'm like, I'll go in on Monday.
Yeah.
This was on a Friday.
Knowing that it was broken, probably.
I knew they were
in your
both
head.
broken. I couldn't move much. I had to drive home. I lightly gripped
Dealt
the
with it.
steering wheel, but I had 2 broken arms, and I'm like, I am not going to the emergency room today because I knew the process. You're going to splint me,
Yep.
and you're going to say, come back, go see specialist, go see ortho on next week,
Yep.
right? So I skip because I'd sit in the waiting room for like 8 hours.
Yeah.
And you're just going to put me in a splint. I can get my own splint, right? And this is me
true.
being young and stupid, but at the same time, the lesson I'm trying to say is sometimes the 3-day window
Yeah.
will give you a little bit more information.
I
But
totally
definitely
agree.
don't be waiting 3 weeks. But with an image, it's so simple to clear. If you've had a trauma,
So true.
just get an x-ray.
I kind of relate it to patients this way. There's plenty of patients who come in the office and say, hey, I think this is soft tissue. I don't need an x-ray. And I kind of relate it to if you take your car into the shop to diagnose a problem, they're probably going to look under the hood, right? I mean, it's just what it's going to be. And I think that's an x-ray for us. Like, it's a simple thing to rule out or rule in whatever's happening. And there may be nothing on the x-ray. It may look perfect and pristine, but there are definitely things that you catch that are little nuances, or because it's not in with, or because there's something not on the x-ray, it gives you a better diagnosis from a provider perspective. It's ruling out that problem.
I got a story for you. This one's
Yeah.
good. So a couple years ago, I was out riding with some of my friends, and I was like 40 miles into a loop.
Okay.
And I hit a rock. I was just like kind of bored, and I was looking around. I hit a rock, wasn't paying attention.
Okay.
Ended up breaking both my wrists. I had to ride back.
Both at the same time.
Both at the same time. Well, it was
That's rough.
Scaphoid here.
Yep.
And part of my metacarpal here. And I had to ride back 50 miles. So you can imagine how big my hands were after this ride.
You weren't very
I literally
comfortable.
could not even take my pants off. I had to ask my father-in-law.
To help.
I tried for about an hour because I was too prideful.
Yeah, of course.
And I literally just could not get my pants off. So my
Yeah.
father-in-law, I'm like, Bruce, I need help.
Helped you out.
Take my pants off, man.
What a guy.
Couldn't get my, I know. Like, it was brutal, but my hands were just balloons.
Yeah.
So anyways, I go home. I wait until, I think 2 days later, go to urgent care,
Okay.
get an x-ray of my hands, both of them. No fractures. Right?
The infamous no fracture
The
story.
infamous no fracture story. Yeah, everything looks good, right?
Yeah.
And this, I'm a clinician at this point. I'm like, okay, yeah, whatever. At least we got that cleared.
Yeah.
I know they're not broken, but I'm pretty sure they're broken.
Yeah.
Right? I've broken a
You're
lot
still
of
concerned.
bones. I know how this goes.
Yeah.
And I also know that urgent care imaging isn't the best imaging, right? And so being my clinician self, I said, I'm just going to go to Bockham up at Tosh and just go chat with
Yeah.
him. Get another x-ray next week,
Yep.
right? And just check it out. Sure enough.
Broken scaphoid.
Tell us about what you know about scaphoids. Why is a broken scaphoid so bad?
Yeah.
And you don't want to miss a broken scaphoid.
You don't. This is kind of an infamous one. So when you fall on an outstretched hand, like we talked about before, like your injury here, they can go undiagnosed even with an x-ray. But the rule of thumb in the world of orthopedic medicine is you treat it until you get proof that it is absolutely 100% not broken. And that comes in 2 forms. It either comes with splinting it and seeing it back in a couple weeks and re-x-raying, or it comes with maybe you decide to get an MRI on this, or it's better in 2 weeks and an x-ray is clean again. And so it's one of those things where you don't want to go with a scaphoid fracture long term that was potentially misdiagnosed initially or wasn't seen on the x-ray, which is valid, like that happens. Because it can lead to a lot of bad wrist arthritis problems.
And if you know the anatomy of a scaphoid, it's a really unique bone because it only gets blood flow from one side of the bone.
Correct.
So if you break the scaphoid, it's the main bone in your wrist that articulates with the other part of the joint. If you break that and it goes undiagnosed, you can literally lose blood flow to the bone.
Bone dies.
and then it goes necrotic,
Yep.
and then you actually have to replace that bone with some sort of replacement.
Yeah.
So
Or you take it out.
keep in mind, like, this is me as a healthcare provider. Imagine
Yeah.
I'm not a healthcare provider. What happens, right?
Yeah.
And they showed me the x-ray at urgent care, and I read x-rays all the time, and I just going off what they say. I glance at it. I'm like, yeah, it doesn't look broken. You're right.
Yeah.
Bockham gets one. What did it look like?
Yeah.
It was extremely clear because swelling had gone down, maybe better x-ray machines, I don't know.
Yeah.
But ultimately, it was so clear. It was cracked all the way through.
Yeah.
And if I would have just ignored what I know and been a normal patient without medical knowledge, I would have just let it heal, right?
Yeah.
And how many of these misdiagnoses happen?
There's a lot, unfortunately.
Yeah. So what is your advice? What's your practical advice for our listeners to make sure they are, making good decisions to get in when they need to, and when they could just be at home and not worry about it?
I think to your point, I think the one thing, I think we all are pretty good at listening to like almost our gut feeling, as we call it, right? Like hey, this just doesn't seem right, or this just doesn't seem like the right answer, right? So you go in, you get seen, and I will tell you, like, urgent cares are inundated with a lot of stuff to know. Like, they are the ultimate like person. When you go in, it's like, hey, you've got sicknesses, everything. You've got heart things, you've got musculoskeletal things. And the reality of it is like their job is to make sure you're breathing and living and feeling okay, right? And from a musculoskeletal perspective, like, yeah, it is the right thing to say, hey, go see a musculoskeletal person if this thing isn't like better. With that being said, if you go in and you get the diagnosis of, hey, this isn't broken, but still a week later things just aren't getting better, it's probably a good idea to maybe say, hey, maybe we get another opinion on this thing. And I think that's what you did, because you're in the medical world and but I think that's the hardest part for people who aren't in the medical world or have nothing. They don't want to be in the medical world, right? Yeah. But I think when you're sitting there saying, hey, things aren't getting better, or they're not getting better in the right way, I think that's where you say, hey, I'm going to take a step back. I'm just going to make sure. And I don't think there's any harm in that. We see patients in our clinic all the time, whether they be for second opinions or whether it just be like, hey, they got told to follow up if things aren't better. And I think that in that scenario where you still got a real swollen wrist, it's still a lot painful. You're pressing on things that hurt, and those places because that's what you do. Mm-hmm. But I think as a patient, I think that it just, when it doesn't sit right, it's time to get more information.
Yeah.
And so we've tried really hard to say, hey, look, if this just isn't getting better, don't wait 6 weeks. Yeah. Don't, because it can be really bad then.
And ultimately, the lesson that you're teaching here is listen to your body. And if this is your kids, listen to them too. Yeah. Some kids complain about stuff, but the majority of kids won't continue to complain about the same thing over and over.
Right.
Unless there's a serious problem.
Or continue to limp or continue to favor that side.
Yeah, you'll watch them and they'll be limping on it or walking weird. That's a signal.
Yeah.
Right?
Oh, 100%.
Make sure you look for those signals, because your body gives you signals when things aren't going right. And if you feel in your mama gut that things are not going right,
it's time.
Probably not going right, right? And you need to advocate and get them to the next level. And we'll talk about sources here in a minute.
Sure, absolutely.
But let's talk about the third problem.
Okay.
Which is people go to the wrong place.
Yeah.
Let's talk about this. Tell me what initially comes to mind when you hear that.
So I think empathy is the word that comes to mind, because like I think for a long time, prior to even me being in medicine or you being in medicine, is you either went to the ER, you went to an urgent care, or you went to your primary care doctor. And again, those people are expected to know a lot of things, and they do know a lot of things. I think from a musculoskeletal perspective, you want someone just like, to your painting business. I don't want a mechanic painting my house. I want a painter painting my house for the most part, right? Maybe they do both. Maybe they do both really well. But the fact of the matter is, you want. Yeah, I'm sure you are. Even with that short finger.
If my brother listens to this, he'd be like, he is not
no
a
way.
mechanic.
But I think empathy for the patient is there. I think the hard part is that if you live in an area where you don't have someone that's a specialist, that's hard. I think you also, just as a parent, it's not like they give you like this book that says, hey, this is what you do when your kid gets hurt or when you get hurt.
Define specialist for us, because I think a lot of our people that listen to this and just consumers in general think specialist means Sidney Baucom at Tosh that
Hand
only does
surgeon.
hand. Yeah, he's a hand surgeon, right?
Yeah.
Is that the specialist that you're talking about, or what specialist are you referring to?
Yeah, I mean, I think that is one for sure, absolutely. And hand stuff, Dr. Baucom is going to do fantastic. With that being said, someone who deals with musculoskeletal stuff in general. So someone who deals with muscles and bones as an orthopedic specialist.
Versus what's the alternative?
Someone who's just a generalist who deals with urgent care or primary care. And again, a lot of these things are...
So are you telling me, I don't want to
Yeah,
cut you off there.
no,
are
cut
you
me off.
telling me that when I go to urgent care,
Yeah.
they might not give me the best advice for my ankle sprain? He's smiling.
That's so hard. That's so hard.
We don't want to throw anyone under the bus
I
here.
don't want to throw anybody under the bus. I think that when you go to an urgent care and it's musculoskeletal rated, you get the surface level stuff in terms of what to do.
Yeah.
And I think that's good. That's what you should be doing. If it's anything that's concerning or even anything question mark, they should be referring you to someone who does orthopedics and sports medicine.
Yeah.
And wherever that is.
And keep in mind, everyone, like, the reason why we're kind of joking about this is because urgent care, it's their job to do everything. They can't know everything, right?
It's super
and
hard.
in the Department of Defense, this is really interesting. I found this fascinating. They've been doing this since the 80s. When you walk into the doctor's office in the Department of Defense, if you're in the military, active military, there's 2 doors.
Okay.
There is your musculoskeletal pain and injury, and there is your illness.
Yeah.
Right? And there's literally 2 doors.
It makes a ton of sense.
And we have not figured this out in society.
Yeah.
Because to know both of those worlds is ridiculously hard.
Yeah.
Right?
Absolutely.
Like, I spent my 3-year doctoral program mastering the injury and pain portion.
Yeah.
Right?
Mm-hmm.
Medical students spend their whole medical school doing illness and diagnoses for cancer and these other issues to keep you alive.
Absolutely.
Right? They spend 3 to 4 weeks on musculoskeletal. They physically cannot know all of the information.
Absolutely.
And our system is changing and it's adapting,
100%.
but it's kind of slow. I'd love for it to match the model, and I think we're getting closer with what you're doing.
Yeah.
We're matching the model, realizing that injury and pain are very different than illness. And we need to get people that are more specialized saying this physical therapists are specialized in musculoskeletal conditions. Your primary care physician is not specialized in musculoskeletal, but they're specialized in illness I don't know anything about, right?
Absolutely.
And like nor do I want to do that, right? But should we fill their offices with back pain?
No.
No.
No, we shouldn't.
People are going to the wrong spot. Tell me about the pathway and how that pathway is really kind of, I don't know, not the best pathway. And what is the best pathway for injury and pain?
Yeah, I mean, I think you talk about the Department of Defense doing that. I mean, I think that's like absolutely. It's like, were you injured or are you sick, right? And I think that's 2 separate things. They can correlate, but for the most part, it's 2 separate things. I mean, to your point of education, you know, as a generalist, as a PA, as a physician assistant, my 2 years of schooling and then, you know, after that was filled with trying to know literally everything from illness to injury. And again, to your point, it's very small in terms of the amount of time I spent on orthopedics and sports medicine. And for a physician who does that, they spend another 3 to 6 years doing that after medical school to be able to be that specialist. And so as a consumer or as a patient, yeah, I think if you can find that door that's musculoskeletal, we call it, or orthopedics and sports medicine, that's the door you want to walk in when you're injured or when you're having chronic pain that is related to bones and muscles. And so from our standpoint, we think we're a good spot, and there's a lot of other good spots, obviously, from that world. But the urgent care, maybe initially if it's urgent and it's emergent, like those things need to happen. And there are times where you absolutely need to be there. But if it's not open or deformed in a way or that kind of stuff where it's truly, truly emergent, then maybe the better answer is walking through that other door that's the MSK, the musculoskeletal.
You think about the amount of money and amount of time that is lost because of going the wrong route is insane to me. I just had this patient that I was talking to yesterday. She was floored.
Yeah.
She got to us last.
So
she went to the ER for back pain, and then she went from the ER to a pain specialist that treated her for 3 months. Then she decided to opt for an orthopedic surgeon, and the orthopedic surgeon, based on the imaging, said, I wouldn't operate on you in a million years, right?
Yeah.
Maybe if you've been dealing with this for a year or more, but your MRI is not showing a lot. Yeah, you're in pain, but you don't have these leg symptoms. You don't have anything severe. So it wouldn't make sense. You're young. It wouldn't make sense to do that surgery.
Sure.
So they referred them back to PT.
It's a good surgeon.
Right? It's like, but literally you think about the steps and the time and
the money.
And she's already 50% better in 2 visits. And she's like, I'm so angry that I went through this whole process in so much time. And then the surgeon was like, sorry, you're on the wrong spot.
Yeah.
Right?
Yeah.
But how often do we see that?
Literally every day in my practice. I mean, literally every day. I mean, it's literally going to a primary care, going to the ER, going to the urgent care, spending that money there. And then hopefully your next move is to a specialty clinic or a physical therapy clinic. But a lot of times it's not that. And that's the hard part. And I tell people all the time, when they come into our office, they're like, hey, this is fantastic. I got to the right place. I got what I needed. The reality of it is they just didn't know about it. And that's the hardest thing for us to say, if you're looking for something fun, you're going to go out and find that something, whether it's a shirt or shoes or vacation, you're gonna be aware of that. When you're injured, it's not like we're selling something fun. Mm-hmm. I mean, as far as just from a business perspective, but when you are hurt, knowing where to go, which door to walk in, I think that's so crucial because you're saving time, you're saving money, you're saving a headache altogether, and hopefully you're getting back to do the things. Because I think about that patient you just talked to me about or just talked about. She's 8, 10, 12 months into this. And what has she been missing because of this 8 to 10 months of just kind of going through this circle that's an already built wheel that just needs to change a little bit? Yeah, and it's not a ton. It just needs to change a little bit.
Yeah, just slight tweaks, right?
Yeah.
And it's really a societal knowledge on how to expedite your care. What door do I walk in first, right? Yeah. Because the door you choose could lead you down a really wrong path. One thing that I didn't mention that she said is, with tears in her eyes, she said, I can see why people get addicted to pain medication.
Oh, 100%. 100%.
I was so sick of this.
Yeah.
Right? And like I said, she was floored. And she was like, I'm just so angry. I've only been here 2 to 3 times, and I'm 50% better, but I'm working on this for, it was in between 3 and 6 months.
Yeah.
She's like, I just wish I would have came here first, right?
Pain messes with your head more than anything. I mean, when you're in pain, you'll do anything to get out of that pain, right? And to your point, we don't want going down bad roads. We want going down good roads to get you back doing the things that you want to do.
Yeah. Now we got to dive into the most important part of this podcast.
Okay.
And that is what you have designed.
Yeah.
The system that I envision when we're talking about the healthcare revolution.
Yeah.
The most efficient system for injury and pain is Ortho Injury Now. Yeah. This is the most incredible thing that I've seen. And I'm so excited to dive into what Cory has created with his team because it is an incredible thing that is going to change healthcare. So we're going to start with a story. You told me the story about this patient that ended up, you saw him in your clinic, mm-hmm. and then you got him to surgery the next day. Tell me that story.
Yeah. So, and this could go for a lot of patients, but the reality of it is had a patient come in, weekend warrior, just feels a pop in their ankle, as we hear, right? So they're running, they take a step down, they feel a pop in their ankle. They don't know what happened, but everybody was basically like, hey, what just happened? He can't walk and whatnot. Comes into the clinic that day. He's diagnosed with an Achilles
fracture. And keep in mind,
fracture.
I really want to emphasize what you and Dr. Dunn have done. This is a walk-in clinic.
This is true.
You don't have to make an appointment.
Yeah.
These guys
it can be crazy
incredible.
Days, but it's fun.
They don't eat lunch. And they don't go to the bathroom. I'm totally kidding. But,
how about that?
But I will say,
you drive through.
I don't want to skip that piece.
Yeah.
The patient was hurt, felt the pop,
that
literally
morning.
Walked into your clinic.
Limped in.
Limped in. Yeah. Now keep going.
Limped into the clinic, was seen. Obviously, we got an x-ray to make sure there was nothing else going on. Was diagnosed.
Clear out fractures.
Clear out fractures, absolutely. Was diagnosed with an Achilles tear. In that scenario,
do the quick Thompson test.
Quick Thompson test. Make sure it doesn't
Squeeze
work.
that cap.
Absolutely.
Yeah, you're right. Your foot doesn't move.
It doesn't work. You're absolutely right. And usually
There's a gap right there.
Usually the story is you got a nice big divot. And usually the story from when you're playing basketball in the morning, this happens, is everybody wonders, like, you feel like someone kicked you in the back and you look around and there's no one there.
Yeah,
right?
Someone shot you in the ankle.
Exactly. So the benefit of our clinic and the way we've designed it is that we're pretty in tune and pretty in touch with all the surgeons, a lot of the surgeons in the area that just do this stuff. And so make a quick phone call, get them in. They were actually seen by the surgeon that day too, because they were close to our clinic and they were able to see him that day. And the next day they were in surgery getting fixed, which is like, from a patient's perspective, number one, just knowing that like you've got a place to go. You can get diagnosed. If it is surgical, we're going to make every step just hopefully seamless for you. And then from the third aspect of things, just making sure you're taken care of the right way.
And Cory talks about this like it's no big deal.
It's every day.
Like this is every day for him. Very routine.
Yeah.
But I hope as you're listening to this, you know that this is not the care that most of us get.
Yeah.
Right? What Cory has designed with his team, with Dr. Dunn, is next level revolution, right? They are revolutionizing healthcare for the better, and it's speeding this process up to get someone in next day surgery. Tell me about a path that you've seen very similar, how long it would take if they took a different path.
Yeah. So in this scenario, you go to an urgent care ER, right? I mean, you have an injury and it's acute and it's a problem. Usually what's going to happen is they may diagnose you with the same thing and hopefully diagnose you with the same thing. And then they're going to put you in a splint, which is absolutely the thing to do. Then they're going to give you either a handout to go see someone, or they're going to give you a phone number, or they're going to say, just go follow up with orthopedics. And you're going to make a phone call either that day or the next day, and you're probably going to get an appointment sometime within the next week or two. And then from there, you're going to get diagnosed, and maybe they require an MRI, whatever that injury is, but in the Achilles scenario. And then
wait for insurance to approve it.
Wait for insurance to approve it always. And then 2 to 3 weeks later, you're in the OR. And that's not an uncommon story. We see that every day.
So what's the math there? How many weeks out were we now?
So surgery? I would tell you that the math, when you sit and look at it from not only just the time, but it's at least probably 2 to 3 weeks in general for most injuries. And again, Achilles may be different, but in general, 2 to 3 weeks. And then the math of going to the emergency room and then all that, it's thousands of dollars before you even have a surgery, which is thousands of dollars.
Versus so what? What are people paying if they come into a walk-in
Just
clinic?
a typical copay and a typical patient visit, which is really nice. I mean, we charge from our standpoint, we're an office visit just like anybody else. We're not an urgent care visit. We're not an ER visit. And so from that standpoint, it's a pretty routine. If you go to your doctor, that's what you're getting, the same price.
I just don't want to understate how powerful this is.
It's fun.
This is so incredible. Not only they're saving you time, money, energy, suffering, right? They're expediting the process by getting you to the right provider, right?
I think that's the biggest thing. And quick.
Cory's phone is just filled with all of the top people in Utah, right? He knows.
There's a lot of people in my phone.
He's got a lot of contacts
in medical
but
world.
He knows the strings to pull. And think of Ortho Injury Now as like the triage specialist for musculoskeletal. They know all the people in the community. They know the top people to get you in quickly, right? They know the top people to treat each condition. They know the top surgeons, the top pain physicians, right? They know they have all these resources.
Don't forget the physical therapist.
Oh yeah, I didn't. We'll leave it to just kidding. But yeah, keep in mind, Cory has a direct line to all of my front office team.
This is true.
And he will message them, and they'll get patients in before they leave his clinic.
This is true. This is true.
This happened
literally yesterday. Yeah. Had a patient literally that day was able to be seen. And I think, from our standpoint, we're pushing on this and we're pushing it hard. I think what you learn as a provider is that when you get into the world of medicine, there's one way to do it, at least we think. And once you start kind of pulling different strings and realizing there's actually maybe a better or quicker way or more efficient way to do it, number one, it benefits like us from the standpoint of just saying, hey, this is so much easier for me to get someone to the person that they need to go to. Or if it's us, they're already there, right? Which a lot of times it's that. But then the second part of that is that patient doesn't have to go home confused about where am I going next? Mm-hmm. What am I doing? Do I have an answer to my thing? You even think
about the wasted energy there.
I mean, I think about the patient. I literally saw, we're doing this podcast in the afternoon. I saw this girl this morning. She went to an urgent care, was told that maybe she has a broken bone, maybe she doesn't, as you were told with your wrist. Came into our office. She definitely has an ankle sprain. I was told that
I didn't have a break.
That's true. This person got called later that night because that's how they managed their x-rays. They did get an x-ray, but they got called later that night and then was told, like, hey, you need to go somewhere. And the hard part about that is now you're just waiting for this process. And where do I go? She came into my office this morning. We know how she got there. Most of the people I don't sometimes know how they got there, which I love, because then they can understand that, like, hey, if you come here, hopefully we make this process a lot more seamless. Got her what she needed. She's into physical therapy. We worked with a physical therapist, not you guys, but we worked with a great physical therapist up north, and they got her in tomorrow. So, the same thing. Awesome. Like, it's one of those things where as you just pull different levers, you understand that physical therapy groups, surgeons, whatever, when they're not inundated with just the wheel they have to run, all of a sudden it changes that person's experience, right? Even MRIs, I would tell you, when I got into the world of medicine, it was like, yeah, you're going to wait 3 to 10 days to get an MRI back. I can tell you that most patients that come through our clinic, they're done with their MRI by the next day. And it's just because of the strings we've been able to pull and get people through quicker, but also just get people through and not wait for the answer that they're going to tell us, which is, no, you got to wait. And we're like, no, we don't need to wait. We need to get this done quicker. So,
and I love, obviously, I'm super passionate about speeding this process up. And a lot of it goes to my history of just playing the waiting game.
Yeah.
Right. And too much money, too much wasted time. Yeah. I'm super passionate about improving the patient experience to the highest level.
Yeah.
That I'll do anything I can to improve the system.
Yeah.
And I just really appreciate what you and your group have done, because it's literally changing healthcare. Because at the end of the day, there's so many patients to be served. I listened to you talk about, different PT groups. Like, you should know all the PT groups, right? You should know what quality of care they provide. You should know where they are, what their access is, how quickly you can get in, right? Yeah. Because it helps you improve the patient experience when you know that.
Absolutely. I think that the nice thing that you learn in this process is, and you hear back from patients, which is great. I would love to talk. I know there's not enough time in the day always, but I would love to talk with patients about their experience afterwards. And I do. I call them. I try to reach out to kind of say, hey, how'd this go for you? And I think the one thing that you get back from patients, the most grateful they are, is just like, hey, this process was sped up. And even if it's the same price, if it can be sped up, let's speed it up.
Yeah.
And there's no reason not to. It's just, let's break down the barriers that were there and just kind of change that way that it was supposed to be. The reality of it is this is the way that it was supposed to be, in my opinion.
And Cory, I love it because it aligns so well with the healthcare revolution. That's what this podcast is all about, is breaking down those walls. The healthcare system was literally created by our insurance companies.
Yeah.
It is time that providers reclaim that.
Yeah.
Figure out ways in which we can speed this up for our patients, because the patients deserve it. And we are the ones on the front lines. We drive healthcare. Yeah. Insurance companies don't. We need to change that model. We need to keep pushing for it. We need to find creative ways to speed this process up for our patients, because I believe we're in a revolution, and healthcare is going to change. And it starts with me and you and working through these processes to improve the patient experience.
Hey, yeah, I totally agree with everything you just said there. It's just pushing different strings. And I think if we're willing as providers, as well as I do, when you were in school, you weren't taught these things. You were just taught how to treat and get people through the door and go from there. I think from our standpoint, it's, yeah, we can do the same thing, but let's just do it the way that you would want to be treated. And I think that's the biggest part. I think about, like, I don't want to wait 10 days or 2 weeks or 3 weeks to get a surgeon. And the reality of it is surgeons were trained to do surgery. That's what they want in their office, to take care of people that need surgery. They don't want to see these other things that are coming through the door. Maybe they do, but for the most part,
Slows them down.
It slows them down, and it slows the patient down, because then they got to wait.
So I just want to kind of, as we wrap this up, share this one story. And I'd love to hear any of your concluding thoughts here.
Love it.
But I know a surgeon that's booked out for 4 months. How many of his patients are probably there for the wrong reasons, and he's actually referring out to other places?
Yeah.
These poor patients that actually need surgery are waiting for 4 months.
Yeah.
That's the access problem we're talking about, right? Like,
Absolutely.
People get in the wrong doors at the wrong time. These surgeons, these specialists, these people are seeing the wrong patients. But if we do this right, you get in the right door at the right time to the right person, and we speed it up for everyone. That patient that needs the surgery can get in within a timely manner
Sooner.
and doesn't have to wait 4 months in misery, right?
Yep.
So when we help one patient expedite the process, it improves the entire system for everyone else.
Oh, yeah, absolutely. I think one of the things that is part of our clinics, all three of them, is that aspect of things. I mean, we've worked with a lot of surgeons, and in terms of what they do in their clinics and what we do in our clinics for them is allow those surgeons to be busier with the people who need surgery, right? And so we take the non-operative stuff and take care of that. We get them to physical therapy, we get them to MRI, like whatever is needed, but it allows their schedules to be basically expedited for any patient that needs that. And so I think there's multiple reasons why a clinic like ours benefits the community, and also just benefits the surgeon's schedule in general.
Yeah. And if, I don't know if you know this, but based on the U.S. Department of Human Services, which is a national group, they have statistically shown us that Utah, we used to be number 49, now we're number 47 for access to primary care physicians.
Ugh.
It's harder to get into a primary care physician in Utah than almost anywhere in the nation.
I can attest to that.
Yeah, I think we all can, right? It takes months to get into my primary care doc.
It took a while.
And primary care docs there's less and less of them because it's such a hard role in triaging and get patients where they want. Imagine if we all adopted the model that you're creating, where it's 2 doors.
Yeah.
Pain and injury, illness.
Yeah.
Right? And we get people to the right space at the right time. A lot of people are going to urgent cares now. Just general urgent cares for everything. They don't really have a primary care. What does that do for them? The provider doesn't know them anymore. They don't know how they've changed over time. There's a benefit to that relationship.
Yeah.
We really need those relationships to come back, and this is a great way of really expediting that. Any other thoughts as we wrap this podcast up?
I mean, I think we've talked about a lot, obviously, but I think that
anything else you want the public to know?
Yeah, that our clinic exists. That's number one. I mean, we have clinic in Murray, and we have a clinic in Draper, and we have a clinic in Farmington.
And if you live in Farmington, man, you better get to that clinic.
Or around.
Yeah, like all three of these clinics are phenomenal.
And I will say, like, I think to your point, I think if you want to get expedited care the right way, and again, even if you have to get into a surgeon, we'll make that happen. We'll make it happen quick. But more importantly, what I'd like to do is get you taken care of without having to have that hopefully happen. And I think getting a diagnosis early, getting to the right space early, and then getting to rehabbing early just gets patients back where they want to be, which is huge. And hopefully it's going to be a lot less cost and a lot less headache part of it.
I love it. And that's what the revolution's all about. Cory, thanks for joining us on the podcast.
Pleasure.